everyone. My name is Dr. Purvi Parwani. I'm a multimodality imager at Loma Linda University in Loma Linda, Southern California. And I'm also the early career chair for SCMR. And I'm really honored and privileged to be joined by Dr. Matthias Friedrich today, who is also the recipient of the SCMR, very prestigious SCMR Gold Medal Award for 2021. So Dr. Friedrich is a professor of medicine, Department of Medicine and Diagnostic Radiology at McGill University, Montreal, Canada. He has been over last 20 years, he has been dedicated to CMR and has established programs in big university, first dedicated programs in the countries that he has been in Berlin and also in Canada. He has really established the top rated clinical CMR services wherever he has gone. He has mentored and trained CMR clinicians and researchers, probably more than anyone in the field, close to 100. And that includes some really big names in the space, CMR space. He has published 17 book chapters, 30 reviews, and given more than 500 presentations over the world. And he also has played a crucial role in the development of society. So he has been with SCMR since 1995, has been a board member for 12 years. He had chaired various committees and finally had the SCMR presidency in 2017-2018 and presided over the largest CMR meeting, 2018, the Barcelona meeting that many of us remember very fondly. So he has made a really major contribution. Anyone in the field knows about his contribution in the myocarditis. And we're going to learn way more about how he thinks about the field and everything around it when he gives us the Gold Medal Award. But today's video is dedicated to knowing Dr. Friedrich, inside out, his journey from early career to now to this gold medal. So Dr. Friedrich, such a pleasure and honor to have you here. Thank you for doing this for us.
Oh, thank you very much. I hope I can live up to the expectations that you raised with a long introduction. Thank you.
So let's start. I told you before we started the meeting, this video, that I wanted to focus predominantly towards the early career. So tell me about, was there that moment? How did you get interested in the field? How was your early career? And what was that breakthrough moment that you realized that this is it and I'm going for it?
It's actually, I'm almost embarrassed to say that it's actually more than 30 years ago now. So I was a medical student. And in Germany, you have to write a thesis to earn your doctorate degree. So I was looking for a study or some project. So a friend of my brother was a cardiologist, and I asked him whether he knows something, and he said, "Yeah, I have something very easy. I'm doing MR studies of the heart." And you just do an ECG before and after, and then you find out whether there's a change or not. Probably there is not, and then you publish it, and then you're done. I said, "Oh, that's too easy for me. Don't you have something more exciting?" So he said, "Okay, I have something. We could do MR spectroscopy." So lo and behold, a month later, I found myself in the headquarters of Siemens that were in the same city as my medical school in Erlangen, in Germany. In the production halls, and we were doing MR spectroscopy, phosphorus spectroscopy. And the moment I saw these images, I was so fascinated that you can see a beating heart, although their spatial resolution was pretty lousy at that time. You could see a beating heart in real time just using magnetic fields. That was so fascinating that I did not let go anymore since then. So that's how it started. I did not plan for a career ever. It was just, I was just always very curious what you could do with it and how this could have an impact on clinical decision making. And then when I started working in cardiology environment, I saw the limitations of what is currently being done. And so it was always my quest to use methods that have been published in MR, and so technically feasible, to see whether they can be used in patients to visualize pathology. So if you, in fact, I consider myself not so much a cardiologist or imaging cardiologist. I think I'm a physiology visualizer. That's what I really enjoy, visualizing physiology. That's, to me, is still the most fascinating thing I could imagine.
That's a very fascinating way to describe it all. That's a really good story. So let's move forward. So we always talk about the role the mentors play, in our life, and you have been a mentor now to so many, CMR imagers across the world. So I wanted to ask you both the sides, like when you were a mentee, what qualities do you think you possess that, pushed you forward to wherever you wanted to go on that path, and what your mentors appreciated? And now in return, what do you expect from your mentees, and how you think a mentor should be?
Yeah. So my first years, I did not have a good mentor. So I had to go myself into, those were the times where you had libraries where you sifted through physical articles, and you had CDs that you had to search for certain articles. So it was really quite painful. And unfortunately, at that time, I didn't have a mentor. I even had a paper with a minor revision in circulation research as a student, which would have been a great thing. But because there was a minor revision, I thought they don't like it. So I never sent it back. So the mentor didn't really care, really. But then I got a good mentor, and all the mentor had to do, actually just give me the room for living out my curiosity. And this is, I think, the most important thing. I was just so keen on understanding whether and how I can visualize pathology and physiology in order to be better at diagnosing heart disease. And whenever I saw something, a paper with a technology, I was always thinking, okay, could we use that? And how would that help? And so this is why I got involved in a lot of, and initially not just MRI, I worked with Stefan Achenbach, for example, also on early CT studies or electron beam tomography. And I found it always fascinating, but the curiosity was, I think, what drove the whole thing. And I was never really good at writing papers very quickly. It sometimes took me a long time, and especially because I found it frustrating that reviewers sometimes rejected it, although it was what I thought was good. But that is what I think helped with my quote unquote career, that I was just so curious. And of course, at some point you think, and I'm also, I've been told by others that I have a kind of a missionary gene. So I'm always a little bit on a mission to show that with cardiac MR you can do a lot. So I didn't want to keep it for myself, so I published it. But it was more really like that. It was not for collecting points or making a career. And this is what, as a mentor, this is what I also hope to find. But it's of course, there are not that many. So I try to give my mentees the space, the support, the financial support, so that they can do what they're passionate about. And of course, I will tell them, look, I think the field is currently at that point. So if you work in this area, and my suggestion would be A, B, or C, but if you have something else that you find really so important that you really want to find out, then go for it. And this is what I consider my task as a mentor. You cannot get someone who's not that interested to be a fantastic scientist. You can do what you want. And you can also not get someone, I would state, to wonderful scientist who does this simply for making a career. Career making should not be the focus. It should be something that happens alongside what you're doing.
Yeah, it should come naturally.
Yeah, and then it's also much easier. It's much
not
less
a burden. Yeah. Yeah, that's a very interesting thought. Thank you. So I think my next question was, so you have been with the field for such a long time. How do you think, like, I don't know, like, what were your thoughts back in the day? Where was the field going? Did you envision 2022 for CMR the way it looks today? And then the next part of that question, what do you think? How are the next 2 decades are going to look like? What are we looking forward to in next 2 decades?
Yeah, so when I look back at the times where it took us about 8 minutes to get a single cine loop of the heart, MR, cardiac MR at that time was really just for people who either didn't understand what they were doing or they were hopelessly optimistic. And I was probably a part of both because looking at how far the path would be, how difficult it would be from the simple concept of using a magnetic field to create visual information to a point where it can use it clinically, efficiently, cost efficiently in other countries, not just the rich and wealthy. If I would have known that, it would have probably been frustrating. But being very optimistic, I thought, oh, wow, if this works, this could be published at the next, or showed at the next Congress, then published. And then Siemens or whoever will produce it, and then it's out there. No, it's much more difficult than that because it has to be reproduced by others. Then there are methodological issues to be ironed out. Then there are technical issues. Then there's the vendor that has to be interested in that. Then the other field and the lobbyists for the other imaging modalities. Then reimbursement, and then the turf war between radiology and cardiology. So, but what I think others also did, like I did, you basically packed on more and more stuff that you can do with MR, which was great because it basically unfolded the entire universe of MR. There is so much you can do with cardiac MR. But this was also a curse because it made this technology appear awfully complex. Everybody thought, okay, MR, this is for the guys at the Cleveland Clinic and at Harvard and wherever. In my hospital, no, that's way too, I don't have the experts here. And this is still the case. And this is still the problem. But now looking into the future, I think we have now reached a time where we have the technology to take all this knowledge that we have built up into more efficient protocols, into more efficient technical approaches. And what I like to call the SMART techniques, simultaneous multiparametric acquisition and reconstruction, like fingerprinting, multitasking, free-running framework. So using one sequence to get information on Cine, T1, T2, and probably more dimensions in the near future. So this is one important aspect. And then by the same token, use these data then with machine learning to identify the relationships between all these parameters to do stuff like tissue characterization without contrast agents. So getting rid of contrast agent, that would help a lot. So you could make the scan not only faster, but also cheaper by not having contrast agent, and you don't need to necessarily have a doctor on site and all the stuff about systemic fibrosis or allergies or whatever. So this is what we have to do over the next 1 or 2 decades. And I think the field understands that. So the biggest challenge will then be really not the technology anymore. And I think also we will be in a space where MR also produces spatial resolution that is similar to that of CT, but with just a much richer information about tissue flow. And also, I'm currently most passionate about oxygenation sensitive MR, using novel approaches to identify molecular or assess molecular information with some limitations, but definitely good enough to diagnose disease without contrast agent and without having a classical stress test. So I think we are there. The biggest challenge we have ahead is more a political one. Will we be able to overcome the animosities between radiology and cardiology? And will we get a fair reimbursement in a value-based context that we say, okay, how much does this scan give us in terms of making decisions? And if I need 3 scans that are way cheaper, it may still be more expensive and the wait time and everything than having one scan that can do it all. And so we have to get to something that Jerry Post, one of the pioneers of cardiac MR, called the one-stop shop, which does not mean that everybody gets the same, has the same question, but in the future, it may actually be that with these new techniques, we can run a 3D scan over time and then later on decide, okay, what is it now what we want to see? Do we want to see inflammation? Do we want to see scar, strain, flow, and then extract these data? So I think that will be the future. And everybody, even the policymakers in the United States, they will have to then accept, hey, this is really cost efficient and better for outcome, better for good decision making. And so that's why I think I will still see that in my next 20 years of cardiac MR.
Wow, no, that I think we have had these discussions before, and I think, as you said, it's kind of like a double-edged sword, right? That one-stop shop tag, because people get intimidated by it, and of course, all the modalities, the complexity between those interactions and stuff, just it just increases the minute you use a word like that. I think that for a multimodality imager, like I was trained in everything, of course, I focused my efforts predominantly on echo and CMR, but I was trained in everything. I think a lot of people that are coming out of training, they again have the same question, right? When is CMR going to take that? Like, how much time are we gonna have to wait till it gets to that prime time, right? Like, because right now people are coming out with a training. Do you think that trajectory of CMR, I mean, it's a new modality for sure. Echo has been around for a long time. Same with, I think SPECT has been long around. Yeah. But do you think that the trajectory for CMR as a modality is going to be kind of same? Or do you think that because all these other modalities are already established, we still have a long time to go to get there, where we are going to be able to convince our colleagues in the hospital who are cardiologists that this is the modality you should choose for because it gives you all the answers?
Yeah, so I'm again, I may be too optimistic, but I think a 10-year time frame would, and it's not about making MR the only imaging modality, and it's not about replacing echo or not even CT. I think each of these modalities have their space where they're good at. For echo, this is bedside. I think the future of echo is basically being the new stethoscope. You have your ultrasound probe, and instead of a stethoscope that hardly anybody really masters anymore, have a tool that actually can give me a quick look and see what's happening there. CT is still the best in terms of spatial resolution, and photon counting CT will make that even better. But CT can only do morphology, really. So nothing really much else. So that leaves a space for MR. I think nuclear cardiology we should let go of that. Let's be honest, there is not much for cardiology that nuclear still has to offer. So that leaves us with echo, CT, and MR. And I think there is a nice complementary pattern between those. And I had an echo lab for 2 years, and I did a lot of echoes, more than 4,000 actually myself, because in Germany you don't have echocardiographers. You have to do them all yourself. And I perfectly understand the advantages of echo, but also the limitations. And to me, having an echo in certain situations is a good thing, but whatever goes beyond history, physical exam, echo, and ECG maybe, I think has to get, and then can come from MR. For the next 10, 15 years, I think CT will be still there for plaque imaging, coronary. But in the future, I don't see any other modality that could do that job. We want to know, and COVID was a good example. I mean, what would we be in the COVID times in terms of understanding cardiovascular implication without MR today? It would be horrible. We would say, yeah, probably 3 to 5% have something. And lots of people with atypical symptoms and stuff like palpitations, we would not recognize it. So that's to me a good example of why the world also more and more understands why we need that modality.
Yeah. Okay. And I wanted to ask you about SCMR. I know you have played a huge role in the development of society in, in major blocks, these foundational blocks. But what do you think? How did society and bringing, group of all the individuals that are like-minded together play a role in shaping up your career?
Oh, it is so important for me. Still, and I mean, now with the COVID times, unfortunately, it didn't happen. But those 4, 5, 6 days of the SCMR were always the highlight of the year for me. It was like a 5, 6 day intellectual party with friends. There is nothing really better being with like-minded people, discussing interesting stuff, seeing what others come up with new interesting ideas that fires up your own brain. So the SCMR, the annual sessions were incredibly important. Also beyond that, the work I was privileged to be involved with in the committees, finding structures to motivate people to go beyond their daily work and do something for the field and for the society. This spirit was so important, and I hope that many young people consider being active, because it changes really so much. And then, of course, we had some really wild times. I remember when there was this discussion, should we include CT in our society? And it almost broke the society. And we had discussions and fights until 2, 3 a.m. in the morning to eventually come to a decision. And then when it was about should the JCMR become open access or not, so there were lots of coalitions on the hallway, and so this has definitely shaped my professional life in a big way. So I think without the SCMR, it's hard for me to imagine how that would have been without having this input from all these wonderful people. And what I also think truly is the CMR community is different from others.
I think so too.
Because in order to be in this field, which is so complex and requires so much optimism, you need to have a certain you need to be optimistic, you need to be positive, you need to be collaborative, and you need to be imaginative. And these are the best people to work with. So that's why I always enjoyed being with the SCMR.
No, I think I definitely, since I've been with the society, I was telling someone yesterday, it's very different. I'm so inspired and touched by leaders like you. I have been fortunate to interact with you, on various topics, and it's been really amazing experience so far since my fellowship that I've known all of you leaders in the SCMR field. Okay, last but not least question. I told you I may ask you this. So the whole work-life balance. I was asking Dr. Stuber about this, and I thought I'd ask you as well. So a buzzword that's, my generation is very fascinated with. And I know we have had some discussions on your hobbies, but what are those things that get you in that, flow status where you're good to go? And how do you kind of balance the life with this amazing professional career that you have built?
Yeah, so this is not that easy to answer. I'm not entirely sure what I could recommend for work-life balance. I absolutely agree that people should not be doing what they don't like for longer than a certain period of the day, because it's just exhausting. If you're forced, due to whatever reason, to do that, I think you have to balance that with something that basically restores you and makes you happy again. Being a clinical researcher, to me, in imaging, allowed me to do what I'm really passionate about. I'm passionate about learning, I'm passionate about understanding, and I'm passionate about images. I'm passionate about physiology. So I could do all that. So that is why you could find myself you could find me on a weekend using an app and go through articles in between, not necessarily for the whole time. I'm not absolutely crazy, but in my spare time, do these things, and I enjoy them. So I could also probably read, and I also read books, and I'm very interested in nutrition and very interested in physics or quantum physics, although I don't understand really a lot at all. So I have other interests, don't get me wrong. But to me, reading and thinking about my work is not work in a sense that it exhausts me. So that's why certainly I need a balance. I work out every morning, and that's what my body needs to get going. And then after half an hour or 45 minutes of working out, then and a cold shower, an espresso, and then my day starts. And then it's already pretty good. But then it's, to me, it's really the balance is important in a certain sense, but not in a sense of getting rid of work, at least not for me.
That's a great answer. Kind of the same answer, what I got from Dr. Stuber. So it's kind of like it's very interesting, and it's actually really amazing that how much you guys love what you do, and we are just fortunate to have you in this space. And congratulations again on your gold medal. And we're all looking forward to your lecture at SCMR 22. So I will see you again virtually in February.
Yeah, hopefully this will be the last time that we'll have to.
I know.
Virtually. Thank you very much, Purvi.